Hi everyone, welcome to the continuation of the CCS. So our patient for today is a patient with a headache and a fever, headache and a fever, headache and a fever. Headache and a fever could be encephalitis, let's see the differentials, could be meningitis, inflammation of the meninges, inflammation of the brain, which is encephalitis, or it could be just sepsis. So for meningitis, this case is going to be bacterial meningitis. So let's do run over the case, and then we see if they change the case, how do we respond, okay? So let's start. So the timing, so initially use two physical exam, focus physical exam, because it's an emergency. Once you do, you find neck stiffness and all this good stuff, and then you do, it's an emergency room. So you do police BS, police P, pulse ox, O, oxygen, all intubation if needed, okay? Not all the time. I, IV excess, IV fluid, E for EKG, you don't need that this time. And you can do, you do the cut gleam with that too. CBC, CMP, chest x-ray, UA, blood culture, urine culture, okay, and you check urine output too, and then head CT. So this is the idea. When we have a fever, it's usually common. We search for an infection. We gotta know what's the source of the infection. So we do head CT, blood culture, chest x-ray, could be lung, could be from the kidney, UA, okay, all this good stuff. And then we give oxygen, head elevation, bed rest, IV access, normal saline, and then we give antibiotic. We shoot blindly. That's what we do initially. Ceftriaxone, vancomycin, blindly, okay? We just shoot blindly. We don't know what's going on. So we give ceftriaxone, vancomycin, we give dexamethasone IV just to decrease the inflammation, IV Phenergan for the nausea, acetaminophen IV for the fever, and we cancel the hydrochlorothiazide, okay? This is important, okay? So we cancel before performing lumbar puncture, because we want to do lumbar puncture, because if we give hydrochlorothiazide, deplete the water, and then we give lumbar puncture, there's a risk of herniation. So we don't want to do that, it's not good. Okay. Okay. So after that, we do that. Then first we cancel hydrochlorothiazide and we shoot blindly with antibiotic. And then we do the lumbar puncture with CSF analysis. We check for glucose, protein, gram stain, fungal stain, bacterial antigen, culture and sensitivity. Okay? So look, notice, initially we did the blood culture, then the antibiotics, and then the lumbar puncture. After that, we advance for CSF results. CSF is consisted with bacterial meningitis, CSF gram stain, gram positive, diplococci, so just pneumococcal etiology, okay? So this is all in the emergency room. After that, we admit V, panic, okay? V for vitals, we already do this, so we just vitals like every 4 hours. PPI if needed, we don't need that this time. Activity betters, we already did that. And NPO, we already did that, I think, yeah. We already did that. Compression stocking, we can do that. Okay, and then we advance the clock to evaluate every 8 hours, okay, and request interval history. And pay attention, because at the exam, okay, I did the exam, and the case ends all of a sudden out of nowhere. You don't know, and the case, boom, ended. It's like that. Culture, confirm pneumococcal meningitis. After that, after till improve, okay, once the patient improve, and we know what's our diagnosis, the antibiotic that we gave is the correct ones. So once the patient improve, we just cancel the NPO, oxygen, pulse ox, and urine output, and we order low salt diet and out of bed in chair, okay? This is what we do. And then we just follow up every 12 hours, okay? and we continue the management of the case, and it will just follow up. Okay, so let's see what happened. There are some medical knowledge that we need to know. So there's a CSF that indicate bacterial meningitis is that white blood cell count more than 1000, polymorphonuclear so more than 1000 white BC, polymorphonuclear leukocyte predominant, and then the glucose is less than 45 and the protein more than 250. Okay, so three things. This is very important. And once the CSF confirmed the diagnosis, so the CSF culture, once it confirmed the diagnosis, then so this lumbar puncture is just suggest the bacterial meningitis, but the CSF is the one that confirm the diagnosis. The culture is the confirmatory test. Okay, so now there's something very, very important, indication of head CT prior to lumbar puncture. So there are a couple of signs and symptoms that we gotta look for. Number one is papal edema, focal neurologic deficit, obtundation, history of CNS disease, recent seizure, immunocompromise. Okay, so 6 things. Okay, focal neurologic deficit, papal edema, history of CNS disease, recent seizure, immunocompromise. Okay, after that we cancel hydrochlorothiazide after we do the lumbar head CT prior to lumbar puncture, and then we cancel hydrochlorothiazide before performing lumbar puncture in patients with suspected meningitis, just to determine whether head CT is indicated. Okay, so now the medication, how do we narrow based on the lumbar puncture results? So initially we add ceftriaxone, and then we add ceftriaxone and vancomycin, we shoot blindly. We add ampicillin if he's immunocompromised. Okay, we adjust antibiotic based on the gram stain. Okay, if it's a gram positive cocci, same IV ceftriaxone plus vancomycin. If it's a gram negative cocci, we give IV ceftriaxone. If it's a gram positive bacilli, we give IV ampicillin plus gentamicin. If it's a gram negative bacilli, we give IV ceftriaxone plus gentamicin, and we add dexamethasone. Okay, and discontinue if pneumococcal meningitis. Okay, so what are the indications of adding dexamethasone? Because it decreases swelling, as we said, and this when it decreases swelling, it will prevent hearing loss and focal neurologic deficit. Okay, and repeat the CSF if no improvement within 48 to 72 hours. This is other, if it can change, like within 2 days if it didn't improve, we repeat the CSF. And if there is persistent fever more than 1 week, then we repeat the CSF again. Okay, so basically this is about bacterial meningitis. So to summarize everything, when someone presents with a headache and a fever, you put in the emergency room, you do police PS, cut the gleam. After that, the specific ones is that you do blood culture, UA, this is important, and then you gotta look for the indications of head CT before lumbar puncture, which is papal edema, focal neurologic deficit, obtundation, history of CNS disease, seizure, immunocompromise. We do CT scan before lumbar puncture, and then we start with a broad spectrum antibiotic, and then we do lumbar puncture. After we confirm what organism is causing his problem, then we narrow down the antibiotics. Okay, if it's a gram positive, ceftriaxone vanco. Gram negative, ceftriaxone just IV. Gram positive bacilli, ampicillin plus gentamicin. Gram negative bacilli, ceftriaxone plus gentamicin. And basically that's about it for this case. It's very simple and easy. Thank you so much for listening, and we'll see you on the next one.